Ready? Okay. So I just got looking at, and you're calling her Ariel?
Right, or Charlie.
Charlie, okay. And you can take a picture of her so they know which dog we're talking about, okay. And I looked at the x-rays and the lesion where the fracture is. The fact that the dog, I got pain on the dog. I didn't take it out of the cart, but I can get reflexes when I pinch the toes. So there wasn't complete damage of the cord. The fact that she's getting urinary incontinence and is able to hold her urine, that's a really positive thing. So what I had proposed to do was to use ozone, which brings oxygen to the area. And they use it for intervertebral discs, they use it for people in terrible back pain, they use it in osteomyelitis cases where the bones are not healing and they can inject ozone. So my plan was to put ozone over the area, do a little bit of acupuncture to get circulation a little deeper by putting needles around the area. I love that they're going to do the chiropractic, that's really important. Getting some physical therapy and getting those back legs not to be so atrophied would be wonderful if we can get the dog into a therapy, water bed, treadmill. The lump on the right side of the ischium in the rim there could very well be just a hygroma that is developed in the bursa that's present there. So I can't feel that that's a tumor. It's just in a place where there's a lot of pressure that is there and it's possibly causing an issue. My feeling is to spend $1,700 to figure out what that is by ultrasound. Seems like I'd rather spend the money trying to get the back to heal and work on that and get the motion going on. Again, if funds are whatever and you can do whatever you want, spend the money on that. But I think the more important thing is seeing if we can get the spine to be working better. That could be also injected with ozone as well, because it'll bring down inflammation in the bursas too as well. So that's something that I think that getting access to oxidative therapies for these particular lesions on the body is all positive. So to get more circulation to areas is what ozone does. And it reduces inflammation, reduces pain, and really allows the tissue to heal. So that's my push, is to try to do that. On the other side, the dog has been on Clavamox, which has weakened the GI tract of the dog. Because we know a lot about microbiome, that the microbiome is 85% of the immune system. And if we've had the animal on a courses of antibiotic, or at least a course of antibiotic, we may not regain that microbiome for a full year back again. So we've been doing a lot with oxidative therapies, including adding to microbiome restorative therapies. So we do fecal transplants here, and along with microbiome restorative ways. So to enable the immune system to help fight the inflammatory response, we need to have a healthy, responsive gut. We don't know the background of this dog, and she could have a better microbiome than my dogs, but my dogs are 25 years of not having antibiotics and living on organic food for 5 generations. So their fecal is being used nationally as the fecal bank for the United States. So if we can give her a fecal transplant and allow the microbes from my dogs that have not had antibiotics to help restore her microbiome, maybe there are precursors to things that we don't even know about that could help her mend herself faster than if we didn't do that. So that would be my suggestion, is doing some rectal ozone on her, reducing the biofilm, and then giving her the fecal transplant today, and giving her some capsules to take orally to re-inoculate the front end. Because she's just 2 days off of Clavamox, which is the minimum amount of time that I would want her off antibiotics. It's still there, but since she's here, we could do it. I'd like her like 3 or 4 days off, but that's fine. We can do it and re-inoculate the front end. Her heart rate is a little bit slow. Her mucous membranes and color look good. Her energy and attitude look good. And so whatever we can do to enhance her healing ability for herself is what I think we should try.